Hi, my name's Parisien. I'm a denturist and the owner of the Parisien Denture Clinic in Windsor, Ontario. And today I wanted to talk a little bit about sleep apnea. It's something that a lot of people have probably heard of but don't really know what it is, even though roughly about 20 to 25% of the population probably has sleep apnea. So what sleep apnea is it's a condition where you basically stop breathing while you sleep. The muscles, your tongue, your throat muscles, everything, they kind of just relax and they collapse your airway. What would happen is here's a little model to try and describe it. So here would be the airway where you'd normally be breathing. Here's breathing through your nose or through your mouth. So what happens is, first of all, anybody who snores, there's a chance that the back of your throat, all the tissue, might be irritated and might become a little bit swollen, or you could even have fatty deposits at the back of your throat, which close it off. And then what happens is, in the middle of the night, you're normally laying on your back, something like this. What happens is that the tongue might collapse back and you might have an enlarged uvula. I'll just get that out of the way for a second. But what happens is when all of those muscles, whether it's from the throat being irritated or fatty deposits or from the tongue collapsing, when all these things come together, your airway gets blocked off and you stop breathing. So sleep apnea is normally you have to stop breathing for 10 seconds or more. And this can happen a varying number of times throughout the night. Severe cases, people might stop breathing up to 70 times, and it's in an hour. Some people might stop doing that about maybe 30 times or less. So it can result up to several minutes, an hour, where you aren't breathing, which means your body isn't getting the oxygen that it requires. Now, this ends up being a very serious health risk because you get increased blood pressure, the chance of a heart attack goes up, the chance of a stroke goes up, issues with diabetes increase, memory function, headaches, everything. It can have quite a number of fairly severe health consequences if left untreated. So the way we would normally treat sleep apnea is, first of all, you need to get a sleep study done and you need to get diagnosed with sleep apnea. From there, I guess what you can call the gold standard for treating sleep apnea is with a CPAP machine. It's continuous positive airway pressure, I believe is the term for it. But this machine, it works like a vacuum cleaner in reverse. You'd wear a mask and it would go over top of your nose or your nose and mouth, or sometimes it'll just be the two little pieces that would fit inside your nose, and it constantly pushes air in through your airway, which keeps it open, and therefore you're always getting oxygen to your lungs. Now, like I say, that's the gold standard because it's always working. And as long as that machine's going, it's pushing air into your lungs. Now, what happens though is a lot of people end up not being able to wear these devices because, first of all, you've got this big mask with a hose coming off it that's strapped to your head in the middle of the night. It doesn't sound too comfortable at all. People who are claustrophobic might have issues wearing them. A lot of people have issues wearing the CPAP machines. Now, another option is having an oral device made. It is, I guess you could say it looks a lot like a retainer would, but what it does is it fits over top of your top and bottom teeth and it pushes your jaw forward. Now, what this does is, if we were to go back to our model where the airway is blocked off when you're sleeping, what these devices do is they push your jaw forward. Now, when your jaw is pushed forward, as you can see, that opens up your airway and you're able to breathe now through the night properly. So those are the two options for treating sleep apnea. And for those of you who just can't wear a CPAP machine, you may definitely want to try one of the oral devices, because just letting sleep apnea go untreated can be a very serious health risk. So what I'll do right now is I'll show you one of the oral appliances, so that way you can kind of see what it actually looks like. So here is one of the newer generations of sleep apnea devices. These ones are completely digitally made. They're printed on a 3D printer. The fit is very good. The material itself is extremely durable. You could take them, I wouldn't suggest doing this, but you could bend them. They're not going to break. They can be dropped, and the chances of these things breaking are very slim. There's just a little bit of that blue stuff on there. This is my own personal device, and I was just doing some adjustments to it. They're very thin. The material is about 1 millimeter thin up in the front there, which is about the thickness of a credit card. Very, very light. And I have to say they're quite comfortable in the mouth. There's no pain at all. They fit, they stay in place very well. And like I say, these are kind of the new generation of them. A lot of them are made out of acrylic, or a combination of acrylic and metal, which is fine, but hey, things advance over time. All right, so I'll show you what it actually looks like when you have it in the mouth. Because this is the sleep apnea device I had made for myself, because I have mild sleep apnea. So what I'll do is I'll put it in. I probably won't be able to talk very well with this in, but you just put it in much like a retainer, just like that. And you can still open your mouth to a certain extent while it's in, but it pushes, if you can see, it pushes the jaw forward to a certain extent. And this is something that we can adjust. We can push your jaw further forward or not as far forward. And that is all there is to it. They're quite comfortable. It doesn't hurt at all while it's in. If it does hurt, that can be adjusted. They don't really feel that big in your mouth. And really, compared to having this in your mouth compared to this big mask that's strapped to your face, is much more comfortable, at least in my opinion. So it might be something you might want to look into if you can't wear a CPAP machine. So that's just a little bit of information, just kind of scratching the surface on sleep.